In 1 second, technical difficulty. All right, welcome back. Sorry for that. Always technical difficulty. I am sorry about that. I'm just checking the quality of our stream. Give me a few moments. All right, welcome back. Sorry for that. Always technical. All right. So again, good morning, good afternoon, good evening, everyone. Welcome to the another episode of Ang Artimo, and I am your host, Michael D. Peralta. Ang Artimo. For today's episode, we have Mr. Allan Gonzales from Los Angeles, California, joining us today. He will be joined later by our panelist from um, Mr. Mark Alfaro, Mr. Ritche Caburnay, and Ms Rinaliza Bogsulen. Thank you to all our subscribers, likers, followers, supporters for our advocacy in promoting the profession, not only in the Philippines but throughout the world. If you have not followed us or like our page on Ang Artimo, please follow us at Ang Artimo Facebook page, Filipino Association of Respiratory Therapists International, our Facebook group, and Ang Artimo YouTube channel. So you can follow our live stream and also our archives of the videos that are for our past live stream. It is all uploaded and edited for later purposes. Anyway, thank you again for joining us today. Would like to acknowledge all our respiratory therapists, especially our respiratory therapists in the Philippines and our healthcare workers in the Philippines. We do appreciate all your hard work. We all know that the COVID-19 pandemic had another surge, a bigger surge in the Philippines. So our thoughts and prayer is with everyone. It was an unfortunate news that I have read and have received from the ARCPP. We would like to ask for prayers and thoughts to our kabaga, Miss Joe Suniga, the first known respiratory therapist based in the Philippines that have succumbed to COVID-19. Uh, may I ask for a few moments of silence and prayers to our kabaga, our fellow respiratory therapist, Ma'am Joe Suniga. So, yeah, again, it is a very sad news. Um, Mom Joe, I know you're up in, heaven wherever you are. We salute you for the hard work, for your service to our patients and your service to the profession, and we are praying for you and your family, especially during this difficult time. Also, we are also our thoughts and prayers goes as well to all our fellow respiratory therapists that are currently um, um, I wouldn't say suffering, but are that have COVID-19 at the moment. I have received, multiple, just regular chat from our fellow respiratory therapists that they're currently positive, isolated, admitted to the hospital, and are healing from COVID-19. So if you guys need anything, please let us know. We will reach our hands to those good people that can help you with whatever you need. So stay strong. We are with you. It's just unbelievable how crazy it is right now with the COVID-19 surge within the Philippines. But regardless, this is our job. Our job is to take care of our patients, taking care of ourselves, very important, and taking care of our family. So our thoughts and prayers goes to everyone. Um, Also, would like to acknowledge and greet our fellow Christians and Catholics that are observing today. starting today, the Holy Week. So our prayers. I am a Catholic, so we are celebrating or observing Palm Sunday today. So this is the week that we really it's very dear to Catholics and Christians. So thank you for joining us today. Some of you just have gone to the church or have gone to online service. So thank you for joining us today. Um, all right. So moving forward, we would like to again thank you our past speaker for last week, Mr. Leonard Higoy from Alberta, Canada, who gave us a great lecture regarding MDI with spacer versus nebulizer. And he also gave away 5,000 Philippine peso to our grand winner for last week. It is Miss Fredeline Badol. So our second, who received 5,000 pesos directly from Mr. Leonard Higoy. Congratulations. And our second and third placers, which are Miss Ma'am Bessie Esguera and Ma'am Jessa Milgar, who receive 1,500 Philippine pesos from ang Artimo show. So thank you and congratulations. These are students from Pine City College in Baguio City. So hopefully the little amount that we have gave will help in little ways with your whatever needs you have at the moment. So that's all I have. I would like to thank each every one of you. Just stay with us. I will introduce now our speaker or our guest for tonight's show, Mr. Allan Gonzales. And give me 1 second here, and he will be joining us here. Um, all right, we're now live, Mr. Allan Gonzales. Good evening and welcome to the show.
Good evening, Michael. Thank you very much for having me here in the show.
You're very welcome. Thank you for answering to my request to be a guest and a speaker for our show. I appreciate it, and surely a lot of our supporters, members, do appreciate your presence for tonight, as you will share your experience, expertise, and knowledge for RT education and during the COVID-19 pandemic. All right. So now we will start with our question and answer, Mr. Allen. Uh, can you briefly tell us about yourself? I think I would go for a question. From what respiratory care school or respiratory therapy school you graduated from?
I graduated from Mount San Antonio College. It is located here in Walnut, California, in Southern California. It's about, I would say, maybe 35 miles east of Los Angeles.
Mm-hmm.
And at the same time, it is a community college.
Mm-hmm.
That means that that school only awards degrees for a 2-year program in respiratory therapy. But here in the United States, associate's degrees are the entry level to enter the profession, as compared to our colleagues in the Philippines, in which the degree to enter the profession is a bachelor's program,
Right.
which sometimes I'm kind of envy. I hope I could have studied there as
Yeah.
compared to,
Same here.
and then just bring the education here and then enter the program again just to get some more education.
Yeah.
So it's a good program. It's a very reputable school as well.
Yeah. Actually, I have heard of the school before when I was in back in college about 10 years ago when I was in LA. I was looking at that school to be, and looking into respiratory therapy program. So, so it's weird that that was my first question, but again, sorry. Where are you from, Mr. Allen? Can you tell us where are you from here in the United States and where are you from the Philippines?
Here in the U.S., I'm from Los Angeles, and in the Philippines, I come from Malabon City, north of Manila.
Nice. Tagalog.
Tagalog.
Yes, and Baha.
Oh yeah, sometimes we go to school. When I was in elementary and high school, I would ride a bangka. So I'm used to it.
Yeah, I mean, even up to now, for sure, our citizens, our fellow Filipinos in Malabon, still. I mean everywhere now, they're still flood. Anyway, on to the next question um, is respiratory therapy your first, I would say, career or profession, or have you gone other profession or career before respiratory?
Well, in the Philippines, I wanted to study broadcast journalism. My
Mm,
mom graduated from UST in journalism.
mm,
My dad from San Beda and UE College of Law.
mm,
But when I came here to the United States, my first choice was accounting.
mm,
Um, but when the recession hit, then all of a sudden everybody is losing jobs except for healthcare. So I said, you know what, let me go and do healthcare. It ended up being respiratory. That's another story. I ended up inquiring about nursing,
mm,
but nursing is a year program. So the next thing on my list was radiological sciences. I
mm,
want to be an X-ray tech because they handle machines, and I love computers.
mm,
However, their program started, so and I needed to start right away.
mm,
So the last on the list is respiratory therapy. So first thing came to my mind is, what is respiratory therapy?
mm,
So I inquired at the office at the college at Mount Sac, and they told me it deals with the lungs. And I said, does it use a stethoscope? I remember when I was a kid, I had a toy stethoscope. I loved it very much. And when they said it does use a stethoscope, I said, okay, sign me up. And the rest, as they say, is history.
yeah. That's awesome. I could relate to that. When I was in high school, I really wanted to go to mass communication, major in broadcasting. That's what I wanted to do. So, luckily, with this show, I was kind of fulfilling one of my dreams to become a broadcaster. And thankfully, YouTube and Facebook is now, you know, fulfilling your dream is not impossible nowadays, especially in broadcasting.
Right.
So here we are. Yeah, that's good. And Mr. Allen, so you graduated from Mount Sac for your respiratory therapy school. If I may ask, what other degrees do you hold, and what credentials do you hold?
Well, prior to respiratory, I got an associate's degree in East Los Angeles College in liberal arts, and that doesn't really mean anything. It's just general education.
Mm-hmm,
And then I went to California State University in Los Angeles. I
mm-hmm,
majored in economics, minor in social and behavioral sciences, and then I, took my master's in education, specializing in adult education and administration from Jones International University in Colorado.
mm-hmm,
And then I did a, certificate of advanced graduate study at Northeastern University in Boston, majoring in education leadership management with a
mm-hmm,
concentration on organizational leadership and communication.
mm-hmm. That's awesome. And for your NBRC credentials, RRT, or do you hold other specialty credentials?
Yeah. Currently, I am an RRT, or a registered respiratory
Mhm.
therapist. I'm also an NPS, neonatal pediatric specialist,
Awesome. Thank
and
you.
I'm currently working on my ACCS, the adult critical care
Yeah,
specialist
that
credential as well.
that's awesome. I've been working on my NPS and ACCS since I graduated, but there's no need right now, and I'm still on the mend if I would, take it or not. But I think I should. I am not a good test taker. I'm not a good test taker, and I have, my own anxieties too. But eventually, we will get to that.
We'll get to that. The
Yeah,
important thing is you get there. It doesn't matter, just enjoy the journey.
right. And how long have you been an RT?
I've been an RT since 2003, so I don't have a calculator in me, but
Ah,
many years now.
many years, yes.
Many years
That's
now.
good.
But
Um,
it's still young. We are
uh-huh.
still young as compared to our colleagues.
Right,
So
right.
we are young in the profession.
Yeah, we're very fitting to our millennial audience. We still fit in the category.
Yeah,
So,
yeah.
why? So, besides being curious about other healthcare professions or other professions, why respiratory therapy?
You know, one thing you want to look at is at the end of the day, what did you make a difference in the world? Did you make a difference in someone's life? So I took respiratory therapy because I know every day, even though not every day there's a code, not every day there's a trauma,
Mhm.
but even to the fact of a simple nebulizer treatment, if you know that you took care of a patient and helped them or her breathe a little bit better, that is satisfaction enough.
Right. Very, yeah, very true, very true. I agree. Uh, you know, I myself too did not choose respiratory therapy because I know what a respiratory therapist is. I've gone through the loop to been in college in the Philippines, have went to the United States to look at nursing, radiology, technology, and then ended up, being in the respiratory care program in LA, then ended up joining the military. So it's something that, it's very special, something very unique that that you will enjoy, and very versatile. It's a good profession. um Tell us, Mr. Allen, where have you worked? If you can share those experiences that you have.
I primarily worked in a community hospital,
Mhm.
a little bit east of Los Angeles. The one thing I like about that hospital is I did my clinical rotations there. So even towards the end of my schooling, they gave me a full load. So I was just being observed by my preceptors as I tackle on the entire workload of the RT.
Mhm.
And at the same time, it is a hospital that has a lot of protocols, especially therapist-driven protocols. Whenever there's a respiratory patient coming in, all the doctor will write on the medical record or on the order is RT protocol. And that means all of a sudden they're hands off. So we as RTs, we decide everything from initial assessment, a plan of care. We order the meds, the equipment, the frequency, the dosage, and then we assess any changes. It's our decision. The doctor usually will just sign it off. So they are totally hands off. So, you know, it's basically practicing and applying what you learned in school
Right.
as compared to some other hospitals that my classmates have been. You have to wait for a doctor's order, even though you know what to do.
Mhm.
Where I worked, everything was, all RTs in the front line. Doctors are, just agreeing or disagreeing with you, just
Right.
like our clinical simulation.
Yep. So yeah, that's a very good workplace to be in. A hospital where you have therapist-driven protocols. So basically, you're the decision maker, uh, based
And
off
even
the
during
assessments.
intubation, Michael, even during intubation, other than the ER physician or the
Mhm.
anesthesiologist, the RTs will have priority on intubating a patient even before a pulmonologist.
Right. Oh, that's awesome. I've never had intubated a real and live patient, so that's very exciting. Yeah, that's good. I have worked at at least two hospitals that have those therapist-driven protocol, and you really feel that you are that respiratory care practitioner, and not just someone who takes order from a doctor. That's where should every respiratory therapist, should be having that great assessment skills, having those therapist driven protocol that they can perform their job without or with or without a how would I say it, a direct order from a physician, because again, as specialists of the lungs, we kind of know something, especially we are bedside.
Yep.
All right, thank you for sharing that. And next question is, when you were working bedside as a respiratory therapist, what is your favorite unit? Like, do you enjoy being in a peds, adult, or neonates?
With neonates, I liked it, but for some reason, I can't stay in four corners only. I need to get out and
Mhm.
walk. So even though I love working with neonates, I really want adults. Pediatrics. I've always been assigned to pediatrics. I even have you know the uh, the equivalent of any Disney type of scrubs to make it lively for the kids. My favorite being my scrub that's Mr. Incredible, all red with the
Mhm.
yellow eye in the middle.
Mhm.
With the adults, I like ICU. Um, even floor care. People say, "Oh, it's only floor care." No, in floor care, the goal is make sure that your patient doesn't go to the ICU.
Yep.
If they're on the floors, they're breathing, they're having a trouble breathing, then you treat them so they don't get worse. And at the same time, if your shift is done and there's no code in your area of responsibility, then you've done your job.
Right. That's very true. You are the front line, and that person who prevents any possibility of someone getting worse. That's true. That's good. Same here. I don't. I have trained NICU level 2, and I have worked PICU, or have trained PICU. My coworkers know that I don't want to be in those units because, number one, I don't have the heart to take that, feeling of, seeing those little people suffering. I don't have the guts and the heart for it. I'm too weak for that. But number two is I can't stay on the unit because you have to be there in the unit unless you go to the bathroom or you're on your break. Rest of your
Right.
12
Yeah.
hours, you're stuck there. Yep. That's
Yeah.
what.
Sometimes it gets claustrophobic too. So
Right. Yeah, that's one of the reason I did not continue my the degree in clinical laboratory science when I was in the Philippines, because I know that I can't stay in that four corners of the lab. Even if you move me to hematology or chemistry, it's still within the four corners of the lab.
right.
All right. Next question would be um what is your what is your I think this just are the questions so we can get to know you more as a respiratory therapist. What is your favorite ventilator, and what is your favorite respiratory therapy procedure?
Well, the procedure that I like are, of course, intubation,
Hmm.
um, and A-line insertions.
Awesome.
Um, and then when it comes to the ventilator, again, mechanical ventilation is mechanical ventilation.
Right.
It's the theory. It's
Hmm.
like, whatever vent that comes to you, as, you should be able to adjust.
Hmm.
At least initially, you should know where the power button is.
Right.
However, since I was first exposed to the Puritan Bennett 7200,
Hmm.
that heavy workhorse, then it became the 840 and now
Right.
the 980.
Yeah.
I'm a little bit biased for the Puritan Bennett's.
Hmm.
However, in another hospital where I worked at, everything was servo. So
Hmm.
from the 300 to the 900, 900 and 300, and then the servo I, now the servo U.
Right.
Um, I like that too.
Hmm.
There's really no favorites.
Hmm.
And then when I became a program director at one school, the only ventilator we had was the Draeger. So I
Hmm.
had to learn that too.
Hmm.
So I saw the good and the bad. Right now, in one of the clinical sites that I have, they use the GE CareScape,
Hmm.
in which it also does indirect calorimetry.
Hmm.
So there's depending on the features of the ventilator.
Right.
But I'm biased towards the Puritan Bennett's.
Yeah. Awesome. Same here. PB. I've started. I mean, we have learned from the antique ventilators back in respiratory therapy school, but the first workhorse that I've worked with is a Draeger V. Was it V 5000 or VN 500, and then the
500.
PB 840. Yeah, the PB 840. I love
Yeah.
the PBs too. They're simple. They work. They're not that they don't look like they're touchscreen, but they are, and it does the work without the little whistles, the blows and whistles. But again, we're just taking a feel of what as a respiratory therapist, what just a preference of your ventilator. We are not promoting any brand, or we are not.
Right.
Yeah, just a disclaimer. As you said, a mechanical ventilator is a mechanical ventilator. It does the job. Next question would be what is your most memorable respiratory care moment?
Funny you said that, just because one of the most, probably the most memorable for me was I had this patient, I believe, who had ARDS, and supposedly is just waiting, its time to expire.
Mm-hmm.
Um, Alarms are going off, high pressures. We're talking about, 60s, 70s, and 80s. And he was on volume control.
Mm-hmm.
So on a weekend, while I was working, I switched the patient to pressure control with very low volumes but high respiratory rates. Again, it's just one of those things that you learn in school.
Mm-hmm.
And then I talked to the physician, and the physician apparently was on vacation there, so there was a substitute physician, I guess, somebody who's covering, and she agreed with me. So, in the 12 hours worth of time or 8 hours worth of time, I was able to improve the blood gas of the patient.
Mm-hmm.
And remember, this patient has been comatose for, we're talking about maybe 2, 3 weeks now. I started at 6 a.m. By 3 p.m. or around 3:30 p.m., the patient opened his eyes and started writing on a pad paper, communicating with his wife.
Mm-hmm.
When my shift was done, patient was awake. However, that following Monday, I learned that the physician um, came back from his weekend break and didn't like my settings, so I put him back on volume control instead of pressure control. And then the following day, a patient passed away. So my memorable thing for that is, I think at least I gave I don't want to say I gave, but I was fortunate enough to do some ventilator manipulations for the patient to wake up and communicate with his family.
Right. Very important. Most of us has our most memorable moment as a respiratory therapist or as a caregiver. Either it's good or bad, but at the end of the day, you would always have to think that what have you done for the patient and their families. And for your instance, you were able to give that patient a chance to communicate with the wife before passing. And you know it's just heartbreaking. It's a part of our job. Is we are there on their first breath, and we will also be there on their last breath,
On their
unfortunately.
last.
Mhm.
Correct.
All right, so I think that's most of our question, but I think the last two question is, Mr. Allen, is what is your message to our aspiring respiratory therapists and our current respiratory therapy students?
You got to love people. I know in my years in education, I've seen students who are really in it for the money. And it's not bad. I mean, you need to live, you need to support yourself and your family. So, money's important. However, if that's your primary goal, these are the people that I see that are burnt out easily. They are the first one to leave the profession. They are the grouch, the grouches of
Uh-huh.
departments.
Uh-huh.
For those who really and truly care about taking care of people, they are the one who last. They are the one who usually improves themselves, furthering their education
Mm-hmm.
to improve themselves, improve their practice. So my suggestion for our students is, you got to love people. You got to love interacting with them. It can't be a fake. Sometimes you're tired. I understand that, but you got to, do your shift. Always improve yourself. Always be like a sponge. Absorb whatever you can. Absorb the good and the bad,
Mm-hmm.
because later on you will make a decision that, okay, I'll do the good stuff, and then the bad stuff I won't do.
Mm-hmm.
So treat every experience as a learning opportunity.
Right. Thank you for that. Yeah, it's very, those words are very important, especially coming from an educator. You have to know what you're here for the profession. You gotta have to love what you're doing, and you gotta have the heart for what you're about to do as a respiratory therapist. And if you are there for the money or whatever reasons you are there, and that's your reason, and so be it. But you have to have the heart and passion for taking care of patients, because that's what we're here for. Last question, Mr. Allen, is what is your message to our fellow respiratory therapists, especially for our colleagues in the Philippines? Um, especially during this time of COVID-19 pandemic?
Well, first and foremost, thank you very much for all the service that you guys have done, not only for your patients, but to our profession. I've never seen so many dedicated professionals, that are working in the front line. However, I would like to, even though you guys are dedicated, I would like to be to advise selfishly that please take care of yourself. Just because if you get sick, then kawawa naman mga pamilya nyo. So you got to take care of yourself first, your family, and then your patients. It'll be pointless if you guys are sick. Then nobody will take care of our patients. So take care of yourself.
Yep. Agree. Self care first. Because, if we are well, if we are sane, then we can give our 100% every time to our patients. But if we're burnt out, we are not well, then who's going to take care of your patients? Who's going to take care of your family? So thank
Yep.
you very much for that message, Mr. Allen. And now to our viewers, if you guys do have any question at any point, please leave a comment on our YouTube channel. We are currently live stream on Ang Artimo YouTube channel. If you have any questions throughout the show, feel free to put a comment in there. And if you've noticed any technical difficulties that we're having, just please put a comment in there or send me a message on Facebook so we can address that immediately. Now, for our viewers, we are going for a very brief break as we, excuse me, as we, excuse me, as we prepare for Mr. Allan Gonzales' presentation entitled Respiratory Therapy Education in the COVID-19 Pandemic. So, we are going for a brief break. Here we go. We'll be right back.